Hello, dear viewers. You're welcome to our YouTube platform, Health Tips and Tricks. It's your physician, Dr. Andrew, to take you through. And today we are going to talk about something very interesting. We shall begin with a concern from one of our friends called Seth Morgan from Atlanta, who is concerned. A friend told him that he had a weak erection, and he was worried. What could have caused this? Because it is so disturbing, and he even has shame now. So he's wondering, how can he fix it? Are there ways to prevent it without taking tablets? And what could be causing it? So without further ado, we are going to go into this topic called erectile dysfunction. But before, if this is your first time, kindly subscribe to our channel so that you can continue receiving our updates and health education and tips on how to live your life happily. So we shall talk about something called erectile dysfunction today, which is basically what a weak erection is. What is this? So this is when as a man, you are unable to have a strong and good erection during sexual intercourse. And what causes this? This is usually because the blood flow that is supposed to move to the penis to enable it have a strong erection has been affected by one thing or another. And this can be physical conditions, or sometimes they can be psychological or psychosocial. We shall summarize these and look at how these can lead to a weak erection. We shall begin by talking about some of the physical. So some of the physical, we have things like trauma. For example, you could have had injury to your penile tissue, and this can lead to a weak erection. We have other diseases of the penis. It could be an infection, for example, gonococcal urethritis or otherwise. And then we have diseases of the heart and blood vessels. As we have already mentioned, the reason you get a weak erection is because enough blood is unable to reach the penile tissue to enable it to become strongly erected. So if you have heart disease or disease of blood vessels, it can also affect your erection. And then you have obesity. Of course, you know obesity affects blood flow and the heart. So this can also lead to a weak erection. Then we have other things like metabolic syndrome. Now, metabolic syndrome is a condition that some people get whereby they have high blood pressure, they have high insulin levels, and also their cholesterol levels are high. And this can be can lead to diseases like diabetes, which can also cause weak erections. Then you have neurological conditions. As we all know, for you to have an erection, you need your nervous system, because the signals which enable you to have an erection to prepare for coitus are via the nervous system. So if you have a disease of the nervous system, it can also affect your erection. And we have diseases like Parkinson's disease, a disease which gives people tremors, and we also have diseases like multiple sclerosis, which also affect nerves in the brain, spinal cord, and in other parts. So we also have other health problems, like I was saying. We talked about diabetes, we talked about things like high cholesterol, high blood pressure, and also medications. Now, what are some of the medications? There are many medications you take, over-the-counter medications to treat pain, depression, and other conditions. And some of these can lead to a weak erection. For example, water pills or diuretics. These are drugs used to treat diseases like hypertension and heart failure. These are drugs like spironolactone, drugs like furosemide. These drugs can cause weak erection. And then we have other medications for controlling blood pressure like chlorothiazide, lisinopril, and other drugs like amlodipine and losartan. So if you're on any of these drugs, then you talk to your physician in case you're having a problem of weak erection, then they can help you to adjust accordingly. We have drugs called antidepressants, especially the selective serotonin reuptake inhibitors. These can also cause a weak erection, and they are used for depression treatment. And then we have antihistamines, which are commonly used for treating allergy symptoms. Some people take them over the counter, but these can also give you a weak erection. We have already talked about Parkinson's disease, but even its medicines like carbidopa, levodopa can also give you a weak erection. Drugs like morphine and other opioids can also give you a weak erection. So if you're on any of these drugs, then and you're having a weak erection, then it's the time to either stop them or replace them with an alternative as advised by your physician. Smoking is another thing that can cause damage to blood vessels, like we have always said, and tobacco smoking is harmful for your vessels. Now, if your vessels have been damaged, this can give a weak erection because less blood will reach the penis during sexual intercourse. And then you have alcohol. Alcohol affects blood vessels, it also affects nerves, so it can also give you a weak erection. And there are some of our friends who have had a problem of weak erection, erectile dysfunction, and they use drugs like sildenafil, tadalafil, which are basically drugs to make the erection stronger. If you use these drugs and also take alcohol, alcohol can also affect these drugs. So if you're already sick and you're on these drugs, then avoid the alcohol even more. Then you have sleep disorders. If you're having challenges with sleeping, this can also affect your ability to have a strong erection. And people on treatment for pelvic organs, for example, there are some people who are on treatment for urinary incontinence. This can also affect your erection. Then, of course, the psychological or the psychosocial factors like anxiety, stress, depression, all these can affect your erection. So if you're having challenge with this, these all need to be treated. Now, how can we prevent some of this? As we have seen, the list is quite long. However, some of these can be prevented, some can be stopped. And indeed, once we sort these, then we shall have a normal, strong erection. For example, things like trauma, this is the time to visit your urologist to look at you and assess you and maybe manage you accordingly so that you can recover. Diseases like Parkinson, you speak to your physician to get the best treatment. Neurological diseases, then we have conditions like obesity. Exercise, physical activity can help to deal with this. High cholesterol levels, physical activity, and checking your diet. We shall see what diet is good for people who have problems with the erection, but some of these are ways in which you can help to mitigate some of these. Then, of course, drugs, we say your physician should advise you on which drugs to avoid, and some which can be substituted are substituted. Smoking, cessation of smoking always reverses its symptoms, depending again on to what degree. But most times, once you cease smoking, everything starts to return to normal. Alcohol, this should be limited. If you're already having issues with erection because of alcohol, then it's time to really stop it. Regarding sleep disorders, things like yoga and relaxation techniques can help you to sort this, and this can solve your erection problem. Other problems like anxiety and stress, these need psychosocial support from our friends and neighbors, from our brothers and sisters and family, and also if need necessary, then you can visit your psychiatrist to do an assessment and treat you accordingly. Thank you for your attention. I was your physician, Dr. Andrew, and today we have summarized some of the causes of having a weak erection and also some of the ways in which these causes can be addressed so that we can have a healthy, normal erection. Thank you for your attention once again, and don't forget to subscribe and remember to keep coming back and watching our health videos for your own health benefit. Thanks.